Hi, my name is Dr. David Zuckerman. I'm the co-founder of a company called Eswt Shockwave Therapy. This is a company that was formed over 10 years ago with its sole purpose to provide extracorporeal shockwave devices to orthopedic and podiatric physicians. In order to understand if you're a candidate for ESWT, you first have to understand the word plantar fasciitis. And that's probably why you're viewing this particular video, because you have plantar fasciitis and you haven't really been satisfied with your treatments because they haven't worked. Most of the time, the reason why treatment doesn't work with plantar fasciitis is because it has evolved into a chronic phase which we call plantar fasciosis. Plantar fasciosis is a condition where, due to excessive inflammation, the fascia, and what the fascia is, it's a broad band of ligament-like structure that supports the bottom of your foot. It's the brake and shock absorber of the human foot. Picture it like a celery stalk. It has lots of fibers. You will be going to our website and you'll get to see pictures of this later on. But the thing I want you to understand is that initially the fascia will become inflamed, just like a tendon in your shoulder, your elbow. You're using it too much, it starts to hurt, you get swollen, you take Advil, you put ice on it, you rest it. The important thing is to get rid of that swelling, because if you don't get rid of that swelling and you don't support the area, or rest the area, or modify your activities, it will develop into a degenerative phase called plantar fasciosis. And this is something that usually in the past led to foot surgery. And as we all know, plantar fascia releases, that's where they cut the fascia, can lead to many complications, some permanent and some serious. My interest in ESWT started in the early 90s. It was developed by a company called Dornier MedTech. Dornier MedTech, as you have probably heard of kidney stone lithotripsy, that's where they use sound waves to break up the kidney stones, is very similar to ESWT. They both use sound waves. In the case with ESWT, the sound wave levels and energy levels are much less. They will dissolve the scar tissue and stimulate the body to lay down new tissue. If we're talking about the plantar fascia, it will actually lay down new cells to heal the area. If we're talking about bone, it will lay down new bone cells to heal bone. If you're talking about the Achilles tendon, it will lay down new Achilles tendon cells to heal the tendon. The significance of ESWT is that it's been tested. It is FDA approved, which means it's been tested. It's safe and effective. In this particular case, the testing was for 2 years, and it was done at Harvard University Medical School, Emory University Medical School, and Detroit Henry Ford Hospital. The advantage of ESWT is that it's non-invasive. There's no chance of infection. You can return to work and most of your activities immediately. And the success rate with the 1-year FDA studies are over 94%. If you would like more information to see if you're a candidate with this procedure, and I'm sure you are because you're listening to this video, you can go to the website www.eswtusa.com. That's www.eswtusa.com. If you'd like to speak to me, Dr. Zuckerman, personally, I will give you my email, which is footcare@comcast.net. That's footcare@comcast.net. I hope this has been interesting and enlightening to you. Thank you.